Brain stroke. Types of, causes, pathology, symptoms, treatment, and prevention. Animation. Did you know that every 40 seconds, someone in the United States suffers a stroke? And every 3 minutes, someone dies from it. The terrifying part is that most of them are still sitting in front of the TV, having a meal or chatting with their grandchildren, until suddenly they collapse. Could it be that one day you or your loved one might find yourself in that very situation without any warning at all? A stroke is not just a passing illness, it is a storm that strikes the brain, stealing away the ability to walk, to speak, and even to live, all within a matter of minutes. Sadly, many older adults dismiss the early signs, thinking, "I'm just a little tired, it's nothing serious," only to realize too late that the chance for treatment has passed. Have you ever wondered what would happen if, at that critical moment, no one was nearby to call for help? The good news is that 80% of strokes can be prevented if we understand the causes, recognize the warning signs early, and take immediate action. The question is, how can we tell the difference between a dangerous signal and something harmless? And more importantly, what must we, those over 60, do starting today to avoid becoming the next victim of this devastating illness? Let's take a closer look at why strokes are so destructive and what makes this disease the greatest fear of old age. Are you ready? For older adults, a stroke is like a hidden trap lying in wait within the body. You may still be walking daily, still speaking normally, but just one sudden event in a blood vessel can overturn your entire life. Do you know why people over 60 face a risk of stroke many times higher than the young? Because as the years pass, blood vessels narrow, weaken, and become more likely to clog or rupture without warning. And when the blood supply to the brain is cut off, millions of neurons begin to die within minutes. The cruel reality is that stroke not only takes lives, but also leaves behind lasting disability. Some are lucky enough to survive, but lose the ability to walk, to speak, or even to recognize their own grandchildren. Can you imagine how merciless that feels, being alive, but stripped of the independence to truly live? In over 30 years of practicing medicine, I have witnessed hundreds of elderly patients struck down by stroke. Some grandfathers who were laughing with their grandchildren in the morning were rushed to the hospital by afternoon, paralyzed on one side. Some grandmothers who had devoted their whole lives to caring for their families ended up in wheelchairs, dependent on others just to eat and drink. Is that the future we want for ourselves? Stroke is a silent enemy, but it is not unbeatable. With the right knowledge, you can take control of your health and reduce your risk by up to 80%. The question is, what types of stroke must we learn to recognize in order to prevent them? The answer may surprise you.
The danger of ischemic stroke. Ischemic stroke is the most common type, accounting for nearly 80% of all cases. Think of the brain as a bustling city and the blood vessels as highways delivering oxygen and nutrients. When a blood clot blocks the flow, it's like a traffic accident that jams an entire road. Everything behind it grinds to a halt. Within just minutes, neurons begin to suffocate and die. Can you imagine how a tiny clot can paralyze an entire body? The most common cause is years of atherosclerotic plaque buildup inside the arteries. When one of these plaques ruptures, it acts like debris clogging the road, triggering the rapid formation of a clot. Additionally, many patients with atrial fibrillation, a heart rhythm disorder, are at high risk, since stagnant blood in the heart chambers can form clots that travel to the brain. The terrifying reality is that once a clot lodges in place, oxygen can no longer reach the brain. Without timely treatment, the patient may suffer permanent paralysis, loss of speech, or even death. Can you be sure you would recognize the signs if it happened to you? And this is only one type of stroke. There is another, just as dangerous, that can strike within seconds when a blood vessel in the brain bursts open. This is a hemorrhagic stroke. Do you want to know why it can be even more devastating? The danger of hemorrhagic stroke. If ischemic stroke is like a traffic jam, hemorrhagic stroke is like a dam bursting, flooding an entire city. This occurs when a blood vessel in the brain ruptures or leaks, spilling blood into the surrounding tissue, compressing neurons, and killing them. Can you imagine that the rupture of a single tiny blood vessel is enough to destroy the brain's control center of the entire body? I remember vividly the story of Maria, a 68-year-old woman in Florida. She had suffered from high blood pressure for years, but often skipped her medication thinking, "I feel fine, I'll be okay." One afternoon, while cooking, she was struck by a violent hammer-like headache, then dizziness, and collapsed to the floor. Her son immediately called emergency services, but by the time she reached the hospital, doctors confirmed a brain hemorrhage caused by dangerously high blood pressure rupturing a vessel. She required emergency surgery to remove the blood clot, but afterwards she was confined to a wheelchair, losing her independence. Do you see how a moment of neglect can cost a lifetime of dependence? The most common cause is uncontrolled hypertension. Others at risk include those taking high doses of blood thinners or those with aneurysms and congenital vascular malformations. When a vessel bursts, blood not only damages the surrounding brain tissue, but also triggers spasms in nearby arteries, worsening the oxygen shortage. Hemorrhagic strokes are often more dangerous because the mortality rate is so high, and even survivors are left with severe disability. The question is, how can we recognize the warning signs before the brain bursts in silence?
Early warning signs. Have you ever heard the phrase, "time is brain"? It means that with every passing minute during a stroke, millions of neurons die and can never be restored. That's why recognizing the early warning signs is absolutely critical. The problem is that many people mistake them for simple fatigue. Are you confident you can tell the difference between momentary tiredness and the signs of a stroke? One of the most common warning signs is facial drooping. Try smiling. If one side of your mouth doesn't lift, that's a red alert. The next is weakness in the arm or leg, such as being unable to lift an arm normally. And the third is language disturbance. Slurred speech, difficulty speaking, or not understanding what others are saying. Do you realize that just these 3 simple signs, if detected in time, could save millions of lives? Beyond the 3 main signs, there are other symptoms. A sudden severe headache, dizziness, loss of balance, or reduced consciousness. So if you or a loved one experiences these, don't hesitate. Do you want to know what happens if we delay emergency care by just a few minutes? Consequences of delayed emergency care. There is a harsh truth that few want to hear. When a stroke occurs, the brain does not wait for us. With every passing minute, millions of neurons die, which means a part of our ability to move, speak, or remember is lost forever. Just 1 hour of delay can reduce a patient's chances of recovery by nearly 15%. Would you risk your future on just a few minutes of hesitation? Stroke is not like other illnesses where treatment can be postponed for a few days. It is a race against time. If treated early, patients may recover almost completely. If delayed, even a little, the chance of recovery slips away. That is why the question isn't, should we go to the hospital, but rather, are you ready to call for help the very first moment you see the signs? And even though many of us already know the dangers of stroke, there are still common mistakes that older adults often make when it comes to prevention. Are you curious to learn which habits are silently pushing people closer to danger? Common mistakes in stroke prevention. What troubles me most is not that patients don't know about stroke. It's that they know but become complacent or use the wrong methods to prevent it. Have you ever heard someone say, "I take aspirin every day to prevent stroke, so I'm safe"? In reality, not everyone needs aspirin, and taking it without medical advice can lead to dangerous bleeding. Yet many people continue to trust in home remedies instead of consulting their doctors. Could it be that this misplaced trust is what brings them closer to stroke?
Another common mistake is neglecting blood pressure and blood sugar control. Many patients tell me, "I feel fine, I don't need to check my blood pressure." But stroke doesn't wait until you feel unwell. It can strike at any time, especially when blood pressure is silently rising without your knowledge. Do you check your blood pressure daily, or are you waiting until dizziness strikes before pulling out the monitor? In addition, many older adults believe that simply exercising is enough, but if done incorrectly, overexerted, or without a healthy diet to go with it, the risk remains. Are you sure you truly understand the right way to prevent stroke? Or are you still holding on to habits that quietly put you at risk? So what then are the scientific, simple, and practical solutions you can apply right away to reduce your risk of stroke? Let's explore this together, and you'll see how small changes made today can save an entire lifetime tomorrow. Did you know the good news is that the majority of stroke risk, up to 80%, can be prevented through simple lifestyle adjustments? We don't need anything complicated, and we certainly don't need frightening medical procedures. All it takes is starting with everyday habits that may seem small. The question is, are you ready to make these changes to protect yourself, starting today? First, control your blood pressure. Checking it daily is like making sure your front door is locked before going to bed. It's the only way to catch problems early, since high blood pressure often shows no symptoms. And if your doctor has prescribed medication, don't stop taking it just because you feel fine. Do you want that complacency to suddenly turn into a stroke? Next is diet. Limit salt, fried foods, and cholesterol-heavy meals, and replace them with vegetables, fish, and nuts. A simple bowl of low-sodium soup can protect you better than 100 pills taken too late. And don't forget to stay hydrated. When your body lacks water, your blood thickens, raising the risk of clot formation. Do you often let yourself go thirsty all day without drinking enough? Exercise is just as important. You don't need intense workouts, just 30 minutes of walking each day or gentle tai chi and yoga. This not only strengthens your heart, but also relaxes your mind and helps you sleep better. And if you smoke, quit today. Every cigarette you give up is one more step away from the danger of stroke. Finally, don't forget regular health checkups. Many patients only discover aneurysms or vascular malformations when it is already too late. So why not get checked early so there can be timely and safer solutions?
We've talked a lot about fear and prevention, but the biggest question remains. After all, what lesson does stroke leave us about the value of health and hope? You see, stroke can come as suddenly as a storm sweeping through life, leaving behind losses that can never be replaced. But at the same time, it delivers a powerful message that every day of good health is a priceless gift. The issue is not how afraid we are, but whether we are ready to turn that fear into motivation to change. Do you believe that today could be the day you begin living a healthier life? I have met many patients who had to use a wheelchair after a stroke. At first, they felt hopeless, believing they had become a burden to their families. But then they learned to practice rehabilitation, to adjust their diet, to persevere step by step. And the miracle was that many of them stood up again, walked again, and enjoyed many more happy years with their grandchildren. This shows us that even after a stroke, hope still exists. But wouldn't it be even better to prevent it from the start, so we never have to endure that pain at all? Life at 60, 70, or even 80 is not the end. It can be the beginning of a meaningful new journey. We can still enjoy peaceful morning walks, warm family meals, laughter, and love, as long as we know how to protect the health of our brain and our heart. Don't you want to be the healthy, sharp grandparent who can play with your grandchildren for many more years? And if your answer is yes, then remember, stroke is not destiny. It is a challenge that gives us a choice in how we live. So here's the final question for you. Will you choose to live in fear, or will you choose to live in hope and take action starting today?